The Nigerian government says it's doing everything possible to address funding and policy gaps in the nation's health sector, especially with the recent cut in funding support by the United States. At an interactive meeting with the Minister of Health and Social Welfare, the House Committee on HIV/AIDS, Tuberculosis and Malaria advocates the establishment of a trust fund. Joke Adisa has more.
On the 24th of January 2025, the government of Donald Trump announced a 3-month halt to USAID funding in more than 10,000 organizations across over 120 countries.
So that there will be a fund.
This interface between members of the House Committee on ATM and the Ministry of Health focuses on understanding the stopgap measures of the government. The committee renews its call for free malaria treatment in primary healthcare centers in Nigeria.
We have always argued for increased domestic funding and less dependence on foreign funding for our health system.
The Nigerian government has launched a committee to develop a transition and sustainability plan for USAID-funded programs. And although the U.S. decision was sudden, its impact was reduced as a result of the various measures put in place.
More than 700 billion naira has been allocated by this president in capital appropriation alone. That is towards this disease. That's not the entirety of the federal health sector budget. And I'll give you an example. There is 288 billion that is for basic healthcare provision fund. That is funding that goes to 8,800 primary healthcare centers.
The lawmakers raised concerns about the challenge of inadequate funding of the healthcare sector and suggest the creation of a trust fund.
We must look at developing alternative funding mechanism. And developing this funding mechanism, we must look at these critical diseases. If there is a way we can have a trust fund on it.
Some drug dealers, some of their shops were sealed in Abia and Anambra because of fake drugs. Very good. But the question is, how come up till now fake drugs are being brought into this country?
If you're able to let us know the areas that we can come in and relate with the state assembly members in order for them to also advise the executive council in terms of the funding.
The minister calls on state and local governments to pay closer attention to the healthcare sector and emulate the tireless efforts of the government at the center for a more robust healthcare system. Joke Adisa, TVC News, Abuja.